Deontic ethics and pro-choice viability. Deontic ethics focuses on duties, permissions, and prohibitions. In this context, the central question becomes, what is the morally permissible action given the constraints of harm minimization and bodily integrity? Before viability, no alternative means. Premise: the fetus is not viable outside the womb. Deontic implication: if the pregnancy must end, abortion is the only available means. Moral status: abortion is permissible because there is no less harmful alternative. The pregnant person's bodily integrity cannot be preserved without terminating the pregnancy. The fetus lacks independent survivability, so no competing duty to preserve life applies. This aligns with Judith Jarvis Thomson's violinist analogy, where detachment from a dependent life form is permissible if no viable alternative exists. After viability, alternative exists, for example, early C-section. Premise: the fetus can survive outside the womb. Deontic implication: abortion is no longer the least harmful means. Alternative: early C-section or induction, preserving both lives. Moral status: abortion becomes impermissible unless the integrity violation, for example, forced surgery, is disproportionate to the risk faced by the fetus. The maternal risk exceeds or equals the fetal risk, warranting prioritization. This introduces a comparative harm threshold. Integrity violations, for example, forced C-section must be justified by a risk level comparable to or greater than that faced by the fetus. Integrity violation threshold. You're proposing a nuanced standard. A bodily integrity violation, for example, forced continuation or surgical extraction, must be warranted by a risk level comparable to the fetus's survival risk. This reframes viability not as a binary moral switch, but as a risk-balancing fulcrum. It demands a diagnostic scaffold for comparing maternal versus fetal risk, a proportionality test for bodily integrity violations, a duty to minimize harm across both agents, not just preserve life. Formal argument: deontic ethics and abortion permissibility across viability. Framework definition. Deontic ethics evaluates actions based on duties, permissions, and prohibitions rather than consequences. In this context, the guiding principle is: an action is morally permissible if it fulfills the duty to minimize harm and respect bodily integrity, given the available means. 2. Before viability, abortion as the only available means. Premise 1. A fetus prior to viability cannot survive outside the womb. Premise 2. If pregnancy must be terminated, abortion is the only available method. Premise 3. Bodily integrity prohibits forced gestation or invasive continuation without consent. Conclusion 1. Abortion is morally permissible before viability because there is no less harmful alternative. The pregnant person's bodily integrity cannot be preserved without termination. No competing duty to preserve fetal life applies due to lack of independent survivability. Supporting analogy. Judith Jarvis Thomson's violinist scenario illustrates that detachment from a dependent life form is permissible when no viable alternative exists. Free. After viability, introduction of alternative means. Premise 4. A viable fetus can survive outside the womb via early induction or C-section. Premise 5. Abortion is no longer the least harmful method if both lives can be preserved. Premise 6. Bodily integrity violations, for example, forced surgery, must be justified by proportional risk. Conclusion 2. Abortion after viability is impermissible unless the maternal risk equals or exceeds fetal risk. The integrity violation is disproportionate to the benefit of fetal survival. No alternative method sufficiently minimizes harm across both agents. Integrity violation threshold, risk-based justification. Principle. A bodily integrity violation, for example, forced continuation or surgical extraction, is only morally permissible if the risk to the pregnant person is comparable to or greater than the risk to the fetus. Implication. Viability is not a binary moral switch, but a fulcrum for comparative harm analysis. Conclusion. Under deontic ethics, abortion is morally permissible before viability due to the absence of alternative means and the primacy of bodily integrity. After viability, permissibility hinges on a comparative harm threshold. Abortion remains permissible only if the maternal risk justifies the integrity violation and no less harmful alternative exists. This reframes viability as a diagnostic fulcrum, not a moral binary, and demands proportionality in adjudicating duties across both agents. Viability matters not because it confers moral status, but because it introduces a new ethical configuration, the possibility of preserving fetal life without overriding another's bodily autonomy. This shift transforms the moral landscape from one of tragic necessity to one of comparative duty, where harm minimization and proportionality become actionable across two agents. Bitte. Supporting argument, why viability ethically reconfigures the terrain. Before viability, ethical monoconsideration. The fetus is entirely dependent on the pregnant person's body for survival. Any duty to preserve fetal life would require overriding the pregnant person's autonomy. Because no alternative exists, the ethical focus remains singular. Minimize harm to the pregnant person. Key insight. Without independent survivability, fetal life cannot be preserved without coercion, rendering duties toward it ethically inert. Bitte. 2. Viability introduces ethical plurality. Once the fetus can survive outside the womb, preservation no longer requires total bodily dependence. This creates a plural moral field. Duties now extend to both agents and must be adjudicated through proportionality. The ethical question shifts from, is abortion permissible, to, which action minimizes harm across both lives without unjust violation? Motivating principle. Viability enables moral pluralism where duties can be distributed without collapsing into coercion. Bitte. 3. Viability enables comparative harm analysis. With alternative means, for example, early induction, abortion is no longer the only way to end pregnancy. But alternatives may involve surgical risk, trauma, or disproportionate integrity violations. Viability thus demands a comparative harm scaffold, weighing maternal risk, fetal survival probability, and the severity of bodily intrusion. Grounding tool. Viability introduces the conditions for proportional adjudication, where duties are not absolute, but contextually activated. Bitte. 4. Viability does not equal personhood. It enables ethical adjudication. Viability is not a metaphysical threshold of moral status. It is a pragmatic threshold, the moment when ethical duties toward fetal life become actionable without violating another's rights. This makes viability ethically relevant not because it defines who counts, but because it defines what is possible. Clarifying distinction. Viability matters because it changes what we can do ethically, not what we must believe metaphysically. Bitte. Conclusion. Viability matters because it reconfigures the ethical terrain from tragic necessity to comparative duty. It introduces the possibility of preserving life without coercion, enabling proportional harm analysis across two agents. This makes it a morally significant threshold not of personhood, but of ethical possibility.